The annual suspected deaths by suicides among Aotearoa New Zealand's Pacific communities has dropped significantly, while the overall figures across the whole population has risen, with Māori continuing to be the worst affected. Among Pacific people, suspected deaths were 5.1 per 100,000 people, down from 9.2 in the previous financial year. Lydia Lewis asked frontline community providers what they would attribute the decrease to.
The whānau's Langiola Healthy Minds manager Renee Richards-Berry believes government funding of community services has played a role in lowering deaths.
I can't underestimate the importance of working with the whole person and the whole family. Being able to have that comprehensive assessment and be able to tackle the causes of distress when working with a person and their well-being and their suicidality. That means being able to have that talking therapy, linking in with social services, linking in with education services, with whānau ora, with other health services that are going to make a difference in that family's life.
She says while it's hard to draw a specific correlation between the work being done by Pacific health providers, on the ground she's seen positive progress firsthand.
We've noticed a real increase over that last year or two of Pacific engagement with our services. We're noticing an increase in complexity of the presentations, I guess, and people are bravely turning up at primary care, usually supported by their family and asking for support. And this is good news, because that's why our services have been set up, to be able to support people when they're experiencing distress.
The whānau's Langiola Healthy Minds service launched in August last year. It provides wraparound mental health support to ensure the triggers for poor mental health outcomes are addressed.
Tackling mental health is not always just about talking, because the stresses come from somewhere, and we need to tackle the stresses in order to be able to make a difference in a family's well-being. And so that will often include linking in with other social services or health services that will reduce distress. And I use the example of housing often, so you can talk about being stressed as much as you like. And if your key stressor is related to not having a house or not knowing if you're able to feed your family the next week, then we can talk about it till we're blue in the face, and that's not going to change the stress. So really it's about being able to link that family into services that will change the long-term outcome.
Former professional boxer David Letele, also known as Brown Butterbean, says services like this are vital in Pacific communities.
In our Pasifika culture, a lot of it gets swept under the rug.
Before a death by suicide can be confirmed, the coroner needs to investigate. This process can sometimes take months or years. Until then, a death is listed as suspected. In a statement, the acting director of the Health Ministry's Suicide Prevention Office, Dr. Sarah Hetrick, says the provisional statistics should be interpreted with caution. Her statement has been voiced.
The trend from 2008 is a more useful way to evaluate any change in the suicide rate for Pacific peoples, and it is heartening to see a downwards trend across this time frame.
Despite the downward trend, Mr. Letele says there's still massive holes.
I wasn't aware of the numbers. We're just so immersed in the work on the ground.
He says it's good they're going down, but one death is still too many.
And what we see, unfortunately, is a lot of need, a heck of a lot of pain. And we do our best to serve and support along with other community groups.
His message to you is,
hey, this is not a sign of weakness to ask for help. It's a sign of strength to do what you got to do to help yourself and help your family.
And if you're in Aotearoa and want to speak with a trained counsellor, you can free call or text 1737. If it's an emergency, call the police.